Good morning, I'm Lori Vick, and welcome to our winter series of webcasts to help us stay in touch and informed about important topics in healthcare. Today, our theme is Matters of the Brain, Summa Health Neuroscience Institute. We're pleased to provide this unique opportunity to all of you, our dedicated supporters and friends, and to present an insider's view about the leading edge life-saving advances for stroke, aneurysms, and so much more. And now let's welcome our expert leaders to share their insights. We have today Dr. Susana Bowling. She is the medical director of the Summa Health Neuroscience Institute. And Dr. Alexander Venizeles is joining us. He is a stroke, neurocritical care, and endovascular neurosurgery specialist at Summa Health. Now, our doctors are fully vaccinated and are wearing their masks and following proper social distancing protocols while we're here in the studio. Now, remember, audience, we want this to be a very interactive session. We've received so many really terrific questions during previous webcasts. We look forward to your participation today as well. Please type any of those questions into the Q&A panel, which you're going to see on your screen. Now, before we hear from our experts, let's have a look at a remarkable story of a mother of a traumatic brain injury patient. Chelsea Susong is forever grateful for the life-saving care of her 16-year-old son, Luke, following a horrific car accident.
On December 17th of 2019, our 16-year-old son Luke was in a horrible car accident. He was ejected from the vehicle and thrown 60 feet, which resulted in a traumatic brain injury. He was rushed to Summa. It's just too painful to process. At that time, the trauma team and neurosurgery team performed emergency neurosurgery. Dr. Borsellino was wonderful. I mean, he saved Luke's life. I'll never forget Dr. Bowling coming in his room and telling us how she had hoped and prayed that he would be her Christmas miracle, and he was. I will forever be grateful for the entire team, every nurse, every doctor, everybody. They were amazing. Luke is absolutely a miracle. Definitely Dr. Bowling's Christmas miracle, 100%.
That is a remarkable story, and we're going to hear a little bit about how Luke is doing now in just a few minutes. You know, Chelsea's story, Luke's story, is just one of dozens of patient care stories, several of which do feature stroke and neurology services that you'll find by visiting summahealth.org/care. Under Dr. Bowling's leadership, the Summa Health Neuroscience Institute has developed into a nationally acclaimed program for stroke care. The Akron campus has been awarded the Thrombectomy-Capable Stroke Center certification from the Joint Commission in collaboration with the American Heart and American Stroke Associations. And HealthGrades, the leading online resource for comprehensive information about physicians and hospitals, named Summa Health one of America's 250 best hospitals in 2021 and one of the top 100 hospitals in multiple specialties, including stroke care. Our neurology services and stroke care are always innovating and growing, remarkably so. And so to share some of the exciting developments, let's turn now to Dr. Bowling. Please launch our discussion with an overview of the Summa Health Neuroscience Institute and Stroke Center. Amazing growth. Share some of it with us, Dr. Bowling.
Well, first of all, thank you for having us here. And a special thank you for those viewers that are taking the time and the interest to learn a little bit about us. And I cannot highlight enough how important that is for us, because it gives us the strength to continue to dream for bigger and better, right? And the program has been probably, I want to say, the fastest growing program in Summa. If you think about 4 years ago, there was a tremendous need for neurological care and neurosurgical care. It was easy for you to have a problem and not be able to access any physician that could have the expertise to care for you. That led to the need, and then the challenge that was taken by Summa administration and clinicians to dream of the vision of an amazing institute, a place that not only just fill up the holes, but actually will make a difference. And we use the quality that we have with the stroke service as our guide. We wanted to be just as good in everything else we did. So we strengthen the stroke service, bring in endovascular services, strengthen the neurosurgical support, bring in 2 neurosurgeons. And then the key was now to make sure we have access for care in an outpatient setting. And in 2020, on February 2020, we brought our 2 first physicians, and that was followed in July by 2 more physicians. You have them here in the screen. And I had to say that they represent the core of neurological services that we can provide right now in combination with our surgical support for neurosurgery and endovascular surgery. So we can take care of Parkinson's, headaches, movement disorders, problems with brain tumors, strokes, all the things that our population needs. And that was our original plan. And now we are dreaming into higher. We want now to be beyond caring for the core needs. We now want to create programs. And we started in July with our epilepsy program, and we are currently searching to grow programs into MS, movement disorders, so the actual programs to just be really an extraordinary center here in our community.
Well, thank you, Dr. Bowling, for that update. And we're going to find out more about some of the specifics of these great programs that you're embarking upon and those you've already made really strong for us. Now let's turn our attention to Dr. Alexander Venizeles, who joined Summa Health in 2018 as a stroke, neurocritical care, and endovascular neurosurgery specialist. He is one of only a few physicians in Ohio with the expertise to perform neuroendovascular surgery. Boy, Dr. Venizeles has come a long way in this since 2018, or your arrival here, and we're so thankful for that. Please provide an overview of endovascular treatments that are available for acute stroke.
Sure. We have come a long way. Myself and a colleague, Dr. Anand, are busy practicing endovascular neuro procedures at Suma. These entail procedures where we access the blood vessel in the groin region or in the wrist, and we float wires and catheters on the inside of the blood vessel to the brain, and we provide treatments in the brain in a minimally invasive manner.
That is remarkable, and to think it was only been a few years that we've been able to do that, and how critical that timing is, and it can be done right in our own backyard now. Thank you for that. We are getting some questions from our viewers, and before we get to them, Dr. Bowling, we mentioned the story of Chelsea and Luke Susong. How is he doing now, first of all? And then share with how his case is just the perfect example of how the Neuroscience Institute collaborates with other teams in our hospital. It wouldn't be possible without that collaboration. And for example, in Luke's case, it was the trauma team. Talk about how vital that is. But first, how's Luke doing?
Well, I have not seen him personally, but we are all keeping an eye on his website, and we had seen that lately he's taken into running again. So I think that that's, it's been over a year, and we're still intermittently checking and see what the family and what he announces about his progress. So it's really, truly a phenomenal miracle. And what it is really, you mentioned, what is a collaboration? We take care of patients every day, and the collaboration occurs with everybody every day. It's like playing a symphony. You have the conductor. In this case, the conductor was the trauma service, but every instrument of that, is important to make the music be beautiful. And so that's what we do every day. We come to play music, if you will, and we cooperate with every service and letting a person or a service be the leaders, and we work to get the patient better, which is ultimately what we all do every day. Mm-hmm.
And as I mentioned, we're having questions come in, and this question is from Tom, who says, you mentioned epilepsy as one of your programs. Can you please expand upon what your epilepsy program is?
Well, thank you for that question, because I'm most excited about it. We had, as I mentioned earlier, wanted to build not only just the core services, but now the actual programs. And we had the stroke program, the neurosurgical program, the endovascular program. It's time to get the next one, and that is epilepsy. We were able to lure an extraordinary epileptologist, Dr. Rossi, who we stole from Rush University, and who I have no questions once you get to know him. He will make a program that will be second to none in this area as well. He's well known nationally, and he has roots in this area, which is one of the reasons we're able to bring him over with us. And it's going to be what we call a level 3 epilepsy center that combines surgery and an EMU and outpatient support with another epileptologist that will take over some of the spells that people may have looking like epilepsy. So it's a whole incredible vision of a program that will take about 3 years to get there. It's a wonderful thing for the community.
A very comprehensive program. Thank you. Dr. Venizeles, endovascular neurosurgery is considered a minimally invasive procedure. Who then is an ideal candidate for this type of procedure?
So we see patients who have issues with blood vessels in their brain. So either a blood vessel is closed off, and we would float those wires and catheters to the location where the clot is in the brain and pull it out. That's called a mechanical thrombectomy. Or if you have bleeding issues in the brain, or other types of strokes, we can stop that bleeding. On your screen right now is an example of a mechanical thrombectomy. So in the first picture, you see that the blood vessel goes and it kind of stops just above the mouth, behind the nose, going to the brain. This is a very important blood vessel called the basilar artery. And we removed a clot from the groin region. In this particular instance, we deploy small little devices inside the clot itself, and we pull them out. And again, you see on the one side of the screen, the blood vessel stops, and on the other side of the screen, the brain is now getting blood. So this particular procedure is a time-sensitive procedure. This is a stroke or a blockage of a blood vessel in the brain. And we treat disease processes like this or bleeds in the brain. That's the majority of how we treat patients.
And if I may add, bringing Dr. Venizelos and Dr. Anand has been just a tremendous value for our community, because in 2018, the world decided that doing these interventions was definitely proof of benefit for patients, and it makes a difference from patients from being able to go home versus going to a nursing home or even dying. So we perform these procedures pretty much weekly, and sometimes even more than once or twice a week at 2 o'clock in the morning, 3 o'clock in the morning. And the number of beautiful stories, thanks to the work of Dr. Venizelos and Dr. Anand, is just, they're piling up beautifully. And so this was one of the best things that we could do for our community.
And to receive that certification is just enabled you to do this and change the lives of these individuals. So
Summa is a thrombectomy capable institution, one of the few in the area, and actually we're in pursuit of something called comprehensive stroke certification. So what that is Susana and myself and the other doctors, nurse practitioners, and emergency medicine doctors, and everybody in the hospital is working together to really achieve the highest level certification for stroke. And we're hoping to be the only one actually in the region that's able to provide those services.
Excellent. Well, we have a question from Barbara. And Barbara wants to know, what are some of the warning signs that indicate you should see a neurologist?
So I'll speak for stroke, and maybe you could speak about other neurologic illnesses, but we think of the acronym B FAST, okay? So the B stands for balance. So any sudden issues with balance. E stands for eye, any eye issues, movement abnormalities, vision loss. F is face, so one side of your face might droop. A is arm. S is speech, slurred speech, difficulty speaking. And T is time, because we can't stress enough exactly how time sensitive this process is and how important it is to seek medical attention right away, to call 911 if you have any of those symptoms.
Thank you, Alex. And from the outpatient standpoint, neurological disorders are actually a presence in everybody's life almost at least one time in their lifetime. Almost everybody has headaches. Everybody may have or not a stroke. They could have problems with seizures or know somebody with seizures, tumors in the brain. So when you have symptoms that are maybe not as drastic as having a stroke because it happens suddenly, but you're having tingling, numbness, gait instability, visual problems that are managed by general neurologists, then obviously the first step would be to be seen by your primary care doctor, who, if they feel that that grants a need for a consult, then refer you to a general neurologist.
Great. Well, here we have a question from Beverly, and this is a very timely question. Beverly says, we have been wearing masks for a year now. I have noticed that sometimes while wearing a mask, I lose my equilibrium. Is this normal because of sight lines for the mask, or is it a sign of a more serious problem?
Mm-hmm. That's a very, very interesting complaint. It's going to be very difficult to guess, over something that can be as serious as an equilibrium loss. To us, anybody who has vertigo is evaluated very seriously in a hospital setting, just to make sure they don't have problems with the vessels going up to the brain. So it's something that may need to be looked at, soon better than later. However, one can just speculate, maybe the mask is making your throat be more dry or more swollen, that affects your inner ear. So it's kind of, I think we all have been experiencing so many unusual complaints of things that we never felt before, just because we have a mask, right? But certainly, if they have loss of equilibrium that is coming intermittently, I would just have that checked, and if it happens to be suddenly and severe, don't question, just be seen. And it's better to be safe than sorry.
Very good advice. Have that checked out. Now, this is another COVID-related question, and that is from Jane. On the second day of mild COVID, I lost my taste and smell. Is this treatable, or is it permanent?
You want to take that?
So usually that comes back after a couple of months, is what we've seen on most of our patients. There are some focal neurologic illnesses that can affect your ability to hear or your sense of smell, but COVID does have that pretty stereotypical and unique finding where you lose your taste and smell. Typically comes back in a couple of months, at least for the patients that I've talked to and I've seen.
Yeah,
so.
There's actually lots of different sites on the web with ideas of what you can do to try to optimize the recovery of the smell, but it's actually a worldwide problem, and the incidence is pretty high of the people that lose their smell. And it's true, the majority of them come back, and sometimes it lingers even for up to 6 months that we know of right now.
It's so much that we don't know, because as they call it, the novel virus, it's novel.
There are specialists doing nothing but evaluating how to treat and how to evaluate the loss of smell, which is called anosmia, which is such a prevalent problem.
Okay. This is a question from George. Do the doctors in the Akron area recognize our capabilities? Are our referrals up with the growth of our capabilities?
That's a wonderful question. We have grown so fast that I think that there's still the understanding and the knowing of what we have available is lingering. So, and obviously COVID also is part culprit of that. Just think about the fact that we started our outpatient clinics the month we closed everything. So my colleagues had to, the first day of work, instead of opening the doors to come patients, they opened the computer to do telehealth. So yes, there is a need still for more widespread knowledge of what we have available here.
Can you talk a little bit about that outpatient?
Yeah, so we have, we want, as I mentioned before, patients were not able to be cared for in this community. They either didn't take care of themselves or they had to be driven. So our vision was to be able to have access to care for these patients. And access means local, close, and also via telehealth. Because some patients with neurological conditions are very debilitated. They can go back and forth quite often. So we have that vision of both locally available and also telehealth. So through access, we have locations in West Market. We have locations in Portage Lake, Barberton. We are now opening, and Suma is opening this outpatient center also in Kent. The one you have in the screen is a location in West Market, and also in a hospital at 75 Arch. So our vision is to try to ensure that we have presence of neurosciences in as many locations as possible to make it easy for the patients.
Great. And then when we are, I'm sure then now that our referrals will definitely go up after they've heard about that, Dr. Bowling, so thank you. Dr. Venizelos, what are some of the methods available for diagnosing stroke?
So when patients come to the hospital with these symptoms, usually they're sudden in onset. So we advise patients to call 911. And what they do urgently, they go straight to the CT scanner when they get here. We have a special imaging modality called CT perfusion, and we use that with the CT angiography to delineate which patients might benefit from more advanced types of care. So Dr. Bowling might get the phone call initially, advised to give TPA, and then she'll give me a ring. If she sees a clot or perfusion deficit on the scan, nowadays those images come right to our cell phones in some cases. And then we take them to, if they're eligible for these particular types of treatments, to what's called an endovascular suite. And what that is, it's a two-planed X-ray machine where patients lay on. It's very advanced, and it subtracts out the skull and the soft tissues so that when we inject dye inside the blood vessels, we can see the blood vessels in very high definition in 3 dimensions. We can use that as a map to actually go and find the problem and try to fix it.
If I may say, we do this very quickly. We every year gain the recognition through the American Stroke Association for our data, the speed and the quality in which we provide care. And I just to let you know, recently we got this, Suma has a stellar numbers. We are able to give treatment in less than 30 minutes, more than 75% of the time, and less than an hour, more than 92% of the time in the last year. So, and over 50% of the time, less than 30 years. It's simply amazing. The group, we're talking about cooperation. This is a true amazing set of organization of different teams working together to get things done very quickly. And there's nobody that does this as quick as we do in this area.
And I think one of the tools that perhaps allows you to be that quick is the use of robots, which might seem, oh, that's a little bit too mechanical, but explain the use of robots in helping to diagnose and get that right initial, very immediate diagnosis and how it works with you.
Yeah, so robots, what they do is that allow us to be there the moment we turn on our computer. And that means that you have an expert eyes on you, on your loved one, the moment the stroke team is called. And it allows us to do the examinations. And so it's beyond just having somebody telling you on the phone what they're seeing. You have an expert kit right there. And that leads to an immediate decision-making, immediate decisions on treatments or not, which is obviously significantly safer. So that's what a robot does, is allow us to get also to places where we can't get fast enough, because you can't drive to places fast enough. And there's no neurologist to plug in every single little ear in the world. So that is what the robots do, give us access to patients immediately.
Mm-hmm. And medicine today is really an interface of technology and knowledge and medicine. So Summa as a hospital system has really invested in our program and enhancing the technology of the hospitals within the health system so that we can provide the most up-to-date, the most advanced therapies for our patients.
And I had to say that patients love it. They always have comments the next day. Plus now it's a pleasure because you don't have the mask on the robots. So at least they can see your face, right? Otherwise they just see masks. And I think the robot is becoming actually more human than the actual presence. Right?
They can at least see your face on the screen,
Yeah.
right? Dr. Venizeles, Wayne is asking, are there any interventional procedures that can be done early on for a hemorrhagic stroke? I hope I'm pronouncing that correctly, to minimize damage to the brain?
That's a good question, Wayne. There are a lot of warning signs for stroke. The symptoms I mentioned earlier might kind of, if you have them for a very short period of time or transiently, might be a reason for you to talk to your doctor, in which case they might order some screening tests. So sometimes I do get patients in my clinic that are referred because a blood vessel abnormality was seen when they were looking at something else. And so they're seeing me because they want to prevent a bleed in the future or a problem in the future. And so I do talk to patients about that. We don't routinely order tests on patients unless there's some symptomatology to warn that they might be at risk for something like that. But there are screening tests, and we do talk to patients not just with strokes and bleeds, but also that have a potential risk for those things.
And Dr. Bowling, this is from Kathleen, who asks, Dr. Bowling, do you treat patients with hippocarpal sclerosis?
So hippocampal sclerosis, I suspect that what they are mentioning tends to be a condition associated with epilepsy. So if that's what they are mentioning, my colleagues coming in July would be absolutely experts on that. But even as now, they don't have to wait for July. There are individuals right now, my outpatient neurologist, that can take care of that. Mm-hmm.
Wonderful. Here's a question from Steve. What is the advice on the use of diet sodas related to stroke?
That's a hard question, Steve. I mean, there's a lot of conflicting data about diet sodas, what's in them, real sugar versus fake sugar, and what it does to your system. I mean, we advise our patients to ingest those things in moderation, right? So I do think if you're diabetic, for example, that a diet soda might be a good option or a good idea, but a can of soda here and there, that diet or is not, probably isn't going to have too much of an effect. The American Heart Association recommends low salt, low cholesterol diet. They also recommend exercise greater than 30 minutes on as many days as you can. And those are the general guidelines for those sorts of things. If you have certain diseases or conditions that are exacerbated by sugars, then we do recommend to avoid those types of things. Caffeine, also in moderation, is something that we try to recommend to avoid in excess.
And Jane has this question. A neurologist diagnosed me with essential benign tremors. It occurs when I'm active. Is this likely to worsen? That's from Jane.
Yeah, that's a very good question. So the answer is there are essential tremors that remain the same for years, and some essential tremors that worsened. A lot has to do if there has been family history of essential tremor. There are plenty of medications that can be used to treat those essential tremors to keep them that it doesn't bother you. But the specifics of is yours going to get worse or is yours going to stay the same? The truth is that we'll see with time, right? Once you follow up with a physician that can see how you do over time. But there's plenty of treatments, including surgical treatments sometimes, for management of essential tremors to make them not limiting or not debilitating.
All right. And Amy wants to know, do you have a program for psychogenic pseudo-seizures?
Actually, I'm so liking that question because we actually, when I say we're creating a program for epilepsy, that's part of the epilepsy program, and it's a multidisciplinary care. A patient with pseudo-seizures, sometimes they can also have real seizures, so we call them mixed seizure disorder. So that's why you need a team of everything from physicians, psychologists, care providers in general that will be able to determine specifically, is this a pseudo-seizure or not? And if it is, how it's getting treated will depend on what's triggering. So yes, we are going to have that as part of a program, and I have a physician coming that has special training specifically on pseudo-seizures, which we're very happy about.
Wonderful. Kathleen is asking, what is the drug known as the clot buster? Does it work for everyone who's experiencing an acute onset of stroke symptoms?
Great question. The clot buster is a medication called Alteplase, or TPA, tissue plasminogen activator. And what that does is when patients have stroke symptoms, they present to the emergency room. We use our technology that we mentioned. Dr. Bowling or myself or Dr. Anand might beam in on the robot and decide that with our ED physicians, it's a good medication to give. We can't give it in all cases. You have to present to the hospital within 4.5 hours. You have to have a certain constellation of findings on the CT images that I mentioned. And what it does is it works through the body very quickly to break apart clots. So hopefully a blood vessel that might be blocked would then open up. One of the risks is bleeding. Obviously, if you're trying to thin the blood and break up a clot, you might also have some issues with bleeding. So we go through a series of questions with all the patients that do receive that type of therapy.
So it can be very life-saving in that quick
Absolutely,
time.
yeah.
Amy has this comment and question for Dr. Bowling. Thank you, Dr. Bowling, for finding my stroke a year ago.
Oh.
Can you talk more about what happens after the diagnosis, the follow-up and long-term treatment?
Right, that's a wonderful question too. Well, strokes happen usually because of a constellation of medical conditions. Those medical conditions like high blood pressure, diabetes, sleep apnea, obesity, all those conditions remain after you had the stroke. So what happened after is really aimed toward controlling those risk factors. So from the standpoint of prevention, I always tell patients, it's not just taking an aspirin and feeling good about yourself because you're taking an aspirin, it's taking a whole of your life and a whole of all the risks, and then addressing each one of the risks independently. And for that, you need primary care to be completely engaged with your care. Then from the stroke standpoint, if you have deficits, it becomes very important to be treated as an outpatient by physical therapy, occupational therapy, speech therapists, and continue to work with them and never give up, because sometimes patients, they will tell you, oh, after 6 months, if you're not better, you're not going to be better. That's not true. I've seen people getting better even 2 years after. Neuroplasticity is amazing, and you have to keep working at it, And sometimes, depending on the cause of the stroke, what led to it, like if there is a critical stenosis of a vessel, if there's a problem in the brain, then my colleagues will be following with a patient, or neurologists if there is consequences of the stroke like seizures or other things, spasticity, things that neurologists can actually treat beyond the primary general medicine problems. I hope I answered that question.
You certainly did. And I think what you're saying really relates to what you had mentioned earlier, how important the multidisciplinary care and the team approach throughout all of the disciplines, physical therapy, primary care, is so important as you relate with the Neuroscience Institute.
Yeah. When I used to see patients on a patient, the reason I liked to follow up with them, it wasn't because I was adding much more to the care. It was because I loved getting them to see them better. It was like a reaffirmation that what we did made a difference. So it was more like a pleasure for me to get to see them. The truth is that the most important people to follow up with after you get out of the hospital is the primary care doctors, because they are the ones that can make the most difference moving forward.
Mm-hmm.
We're very proud to be able to offer all these aspects of care close to patients' homes too. I mean, from the stroke onset to the rehabilitation to the outpatient follow-up. That's something that Dr. Bowling has worked, very hard over the past several years to put together, and I'm really proud to be part of that community care. So.
Mm-hmm. Wonderful. Kim wants to know what type of treatment and what procedures are offered for MS.
Well, so MS has been something that's also evolved dramatically for the last several years. And the core treatment is usually medications. It used to be that you only have options for injections. Now you have oral medications and injections, and sometimes you can have some infusions that you get every so often. So the core remains controlling the inflammatory conditions that lead to MS, what we call disease modification agents. And similar to stroke, then you also have to have physical therapy, occupational therapy, speech therapy to treat some of the results of having an MS flared. And you also need sometimes treatments for the spasticity, which also combine injections, medications, and including surgery. So it's also a multidisciplinary care. But the majority of the true treatments, the aim for management of the disease process is medications right now.
Okay. Michael is asking, do you see work-related concussion patients?
Yeah, so that's another wonderful story, because as you can see, we're growing so fast that we are literally coming out with plans every month. What are we attacking next? Because everything is in need. So we are in a very aware of the fact that we need to have a concussion clinic. We have a phenomenal trauma service that sees a lot of concussions. We have, now that COVID is going to end, a lot of kids are going to go out playing. And so We know we need that. So right now we're actually working with Dr. Babis from Barberton, who has special interest in concussion, to have the vision of what a multidisciplinary concussion clinic will look like. And we actually hope to have it up and running by September.
That's remarkable. Boy, this growth is just impressive. It certainly is. Well, I think we'll close with this last question, because it's not a question, it's a compliment. And Terry has written in to say, I just want to say thank you to Dr. Bowling. I was a stroke patient last year in June at only 46 years old and was very unexpected. Thank you and your team for the care you provided.
Thank you.
I think that's a beautiful way to end our questioning today. And for those in our audience who have additional questions, you can feel free to write in your questions and we'll get them to our doctors to respond to you personally. So don't feel you can't submit your questions further. Before we leave, Dr. Bowling, how can our viewers, they're always asking, how can I support the Summa Health Neuroscience Institute and Stroke Center?
Well, just by being here today, that's already a tremendous support. That, as I mentioned before, it means so much for us, and it gives us so much power to continue to do what we're doing. But as you can tell, we're growing. And when you have a lot of growth, a lot of programs, a lot of need comes with it. And I cannot thank enough Summa administration for the tremendous effort they're doing to support us. And I'm always amazed at how much they're really mindfully helping our program. But there are things that we could do better, and we can grow even stronger with the support of our audience. They can choose what they want, epilepsy, programs with Parkinson's, programs for dementia, programs for MS, all those are in our viewfinder right now. And they can always get back to me, and I can tell them how they can help for each one of the specifics of those cases.
Wonderful. Well, we thank you, our panelists, Dr. Bowling and Dr. Venizelos, and we hope we can make all of your dreams come true. It's marvelous work that you're doing.
Thank you.
And we also want to thank our viewers today. Well, Tuesday, March 30th is a special day. It is National Doctors Day, and that's the perfect day to thank Summa Health physicians who have worked tirelessly to care for our community. Please join us in reminding our healthcare heroes of their importance to our community. Help us say thank you by making a gift in their honor and leaving a note of appreciation. Your gift will enhance programs, facilities, and technology and help Summa Health doctors continue providing our patients with the highest quality care when it is needed the most. Make a gift through the website shown on your screen or call this phone number, 330-375-3159. And following this webcast, all of our viewers, you'll be receiving a survey link by email. Your responses are going to be so helpful as we plan for future topics. So thank you in advance for responding to our survey. Thank you all for being here, and everyone, please be well.